In 2015, the diagnostic criteria for NMOSD were revised to allow us to make the diagnosis after a single attack with the confirmation of a positive serum AQ4 antibody. So early diagnosis is essential in NMOSD to optimize long-term outcomes because patients need to be started on therapy early on to minimize the chance of future attacks that can be devastating. So in this study, we looked at potential predictors of time to diagnosis. We looked at age, sex, ethnicity, the localization of the first attack, the calendar year of diagnosis, and whether or not patients were hospitalized for their first attack. And what we observed is that unfortunately there were significant delays until serologic diagnosis of NMOSD. So the median time to serologic diagnosis was 4 months from first symptoms. And we saw that more than 60% of our cohort had diagnostic delays of greater than a month. So I think that's something we clearly need to improve on in the future. We did see a strong association between calendar year of onset and diagnostic delays, which wasn't unexpected because we know, the assay only became available in 2005, and we've had major improvements over the last 15 years. But one finding which was novel was that we saw diagnostic delays in white patients compared to Black patients and Asian patients. And I think that speaks to our racial biases in the diagnosis of demyelinating disease. So when a white patient presents with a first demyelinating attack, it may be automatically assumed that this is a person who's going to develop multiple sclerosis. And I think that if there are any features that are atypical, any clinical features or MRI features that are atypical, we need to think carefully about that and order serum AQ4 testing, which is a highly specific test and actually also quite inexpensive. So I think it just highlights for us that we always have to consider the patient in front of us and keep in mind what our biases might be, including racial biases.